Hey, Dr. G here with a new health alert. So this is a alert that you could use. This is regarding high blood pressure. We call that, us doctors call that hypertension. It has to do with blood pressure. So on one side of the coin, for those of you that don't want to be drugged unnecessarily, this is an alert for you to watch out for the new guidelines that came out, how they might impact you. And for those of you that say, hey, I'm into mainstream medicine, I'm into seeing my internist or cardiologist, you can use this information to go into your doctor and get checked out and see if you need to be on drugs. So basically, the new guidelines came out that say you're abnormal if your blood pressure is over 120/80. In other words, if it's 121/81, you now have a diagnosis of elevated blood pressure. So you are unhealthy, automatically, newly discovered. So you have just discovered you're unhealthy if you're 121/81. And if you're 130 or above on the systolic number, then especially if you're over 65, you need to be medicated right away. So for you people over 65, if your blood pressure is over 130, you need to be medicated right away according to the new guidelines. And if you're at high risk, you should also be medicated even if you're younger with the 130 or above. Now, how did this all come about? How did the new guidelines, how did they decide on, well, we need more people with a diagnosis of hypertension? So it went from about 73 million people in the United States have that diagnosis to 103 million. So another extra 30 million people may need to be drugged. You know, mainstream medicine likes that because, one, you have a diagnosis, and that way your doctor can get paid. Plus, he has to treat you, so he prescribes a drug, which is pretty quick and pretty easy. And then you have to follow up to see how the drug's working and to check on the side effects of the drug. So it gets you into the system so that, you know, keeps all of our doctors employed and the nurses and the hospitals and health facilities. So this is good for the economy. It's good for the medical system. But getting back to how do they come about, let's change the recommendations. In fact, for older people, they had loosened it to say, don't necessarily treat it unless it's over 150 in older people because they need that higher blood pressure to keep their brains functioning. But no, you know, forget that. We have the new guidelines. They came from a SPRINT study, so a systolic blood pressure study that was done in 2015 where they did a large randomized trial. And what they did is they tried to treat people with hypertension to either be very aggressive and get them down to 120 or below, or be more mild and get them down to 140. And they stopped the study early because they found that when they were aggressive to get to the 120, they had much better outcomes. So what they found, and the study lasted for 3.2 years, with the aggressive treatment, getting everyone down to 120. Now, these are older people though. Average age was 68. And they were all at high risk for cardiovascular disease. So these were people at risk. So if you aren't at risk, these guidelines, even though they're for everyone, regardless of your age, that you have a diagnosis now, but these are people at high risk. And they found a 25% reduction in morbid events like heart attack, strokes, congestive heart failure. So you might say, wow, 25%, that is amazing, because if you think of millions of people following these guidelines, think of how many strokes and heart attacks and heart failure cases and kidney failure cases, which are the endpoint of hypertension often, how many people will be saved. It's going to be amazing, because if you think about 25%, so let's say 4 people makes 100%, that means 25%, if 4 people are taking the drugs, and you know they treat hypertension nowadays with 2 and often 3 drugs. You know, 1 drug's, no, that's no good. You gotta have at least 2, and it's even better to be on 3. The more drugs, the better as far as hypertension treatment is concerned. So everyone that gets ultra managed gets on 3 drugs. So 3 drugs for hypertension, reduce the risk. So you're saying, okay, 1 in 4, that means it's highly likely that I'm going to get a benefit from this. But no, that's the false, the false half-truth that they give you. They tell you 25%, but that's the relative risk. The absolute risk is more like 1.6%. In other words, you have a 1.6% chance of being helped. Now, let me break down the numbers for you. Let's say, for instance, you treat 1,000 people. How many people are going to be helped? Okay, if you treat 1,000 people in this sprint study, when you treat 1,000, 16 were helped. One of those events was helped. But believe it or not, strokes weren't helped. But the other things, heart attacks and things were helped. So 16 people will get a benefit, which is good. But that means over 900 people don't get a benefit. But 22 people, if you treat 1,000, had a serious adverse event. In other words, something that was serious. Now, I didn't look closely enough to see how they define serious, but I'm sure if they said it was serious, it was serious. Something like your electrolytes went haywire and you had to go in the hospital, or you fainted and fell and hit your head, or something in that nature. Something serious happened to more people than were helped. And then 962 got no benefit. So in other words, it's not 1 out of every 4 take the drugs. It's like you have less than 1 chance in 10 if you take the drugs, more like 1 chance in 100 that it's going to help you. So they don't tell you the absolute risk, which is only a little over 1%. They inflate it by telling you the relative risk, which is 25%, which sounds dramatic, but when you look at the numbers, that I have 16 chances out of 1,000 of being helped, and I have more of a chance of having to be seriously harmed, that changes how excited I get about these new guidelines. Now, another issue with this, in the SPRINT trial, they did something special. They took blood pressure, how it's recommended to be taken, to have someone sitting for 5 minutes and relax. Well, what they did in the trial was they put on the blood pressure cuff. They had the automatic blood pressure cuff, and they pushed the button for the blood pressure to be taken in 5 minutes. Then they left the room and told the person, "I'm be gone, don't worry about it, don't talk to anyone, just relax, and I'll be back." And so it kind of took their blood pressure while they're just sitting there staring off into space. So I imagine no one does that in my clinic. I don't think anyone does that in any clinic. We don't wait the 5 minutes like you're supposed to. We're always present when the blood pressure is taken. It's been proven time after time, when a healthcare person is present while you're doing a blood pressure, the blood pressure is higher than if you're by yourself, thinking your own thoughts. So if you take that into account, it means that the people in this study, their blood pressure was measured on a totally different level. And so if us physicians out there in a busy practice use their data and try to go for 120 like they did, and your blood pressure is much higher because we're present taking your blood pressure, then we're going to drug you even more to try to get you that, oh yes, Nirvana 120, that's where we get the 25% risk reduction, which really is only 1.5% risk reduction. So this is an alert to tell you your doctor has these new guidelines. If he wants to be a quality provider, then he needs to follow these guidelines. The American Heart Association and the American College of Cardiology came up with these guidelines. The SPRINT trial was funded by you and my tax dollars. It was a publicly funded study. The publicly funded studies want to get people on drugs. That's their idea. Of course, they say, oh, well, we tell people to change their diet and to exercise. But that's not really what, diet has a secondary importance, but what's really critical, they don't mention it, They don't have a clue what's really critical. Most critical thing is the sun, which I'm always out in the sun, and I have very low blood pressure, and I believe it's because I mind my circadian rhythms by setting my circadian clock, by looking at the sun without my glasses every day, where my suprachiasmatic nucleus gets set for the day. There's multiple studies show that circadian disruptions raise your blood pressure. The other thing the sun does, the mid-morning sun has ultraviolet A light. What does ultraviolet A light do for our blood pressure? Ultraviolet A light stimulates the release of nitric oxide in our skin. Nitric oxide release in our skin dilates the arterioles in our skin to instantly lower our blood pressure. So that means getting out in the sun with your skin exposed, with no sunscreen. Get that UVA light on your skin. It releases nitric oxide. Way cheaper, easier, and more enjoyable than any pill I've ever seen. Okay, the other thing the sun does is it creates in our skin vitamin D. Vitamin D is like a blood pressure drug. Multiple studies show the higher vitamin D levels are, the better blood pressure is. Vitamin D lowers blood pressure. It's created in our skin from ultraviolet B light, which is the midday light because it has trouble penetrating the atmosphere. There's a vitamin D winter anywhere north of the 37th parallel or 39th parallel. So right now, a lot of you are in vitamin D winter. I live in southern Arizona, the 32nd parallel, so we have vitamin D year-round, which is nice. That's why I live here. I don't want to have high blood pressure. Other things you can do, you can take coenzyme Q10. It helps your energy transfer in your mitochondria, proven to lower blood pressure. You can eat seafood. Seafood, omega-3 status in our cells, proven to reduce blood pressure. Something as simple as a magnesium supplement. Magnesium acts as a calcium channel blocker, one of those classes of drugs that they put everybody on. They put everybody on 3 drugs these days. If you like the drug model, so this alert tells you to go get your drugs. There's a good chance that, especially if you're over age 65, that if you haven't been on high blood pressure drugs before, you should be on them now. For those of you looking for other alternatives, I would say use a holistic approach. Another thing that's been proven to lower blood pressure is to stimulate your vagus nerve. You can do that through deep breathing and meditation. It's much more enjoyable than taking a pill. Okay, so if you like this kind of health information, please share this and like it. And I will be talking to you again soon. This is Dr. Richard Gerhauser, and I wish you the best of health.